Hey everyone, I'm Peter Felice. I'm a board certified plastic surgeon at Advanced Cosmetic Surgery in Greenville, South Carolina, and this video is a little bit about mommy makeovers. So what exactly is a mommy makeover? There are lots of different definitions. There are lots of things that you've probably seen on social media or heard from your friends. Basically, it can be a lot of different operations wrapped into one. Most commonly, a mommy makeover is going to involve a procedure for both the breasts and also the body, sometimes most commonly the abdomen. With the changes of pregnancy, breastfeeding, a lot of women will complain of having some deflation or some stretch marks, or they just don't have the breasts in the same upright position as they were prior to having baby. And there are different things that we can do depending on a patient's goals. If the area of concern is breast volume, we have the option of doing a breast augmentation with an implant or fat grafting to try to restore some of that volume, restore some of the shape that's lost after pregnancy and breastfeeding. If the concern is the breast position themselves, if they're a little bit low or ptotic or hanging where they don't want them, or a patient wants them higher on her chest wall, a breast lift is a great operation to change the position of the breast, but keeping the volume relatively the same. If a patient wants to both increase breast volume and elevate the position of the breast, then lots of times we can do a breast lift, placing an implant at the same time just to get both of those taken care of. And a lot of patients will say after breastfeeding that they feel that the breasts are heavy, they're low, they don't want an increased breast volume, but they do want it lifted. A breast reduction is perfect for those patients as well. So in terms of an abdominal operation, it really depends on what the patient's goals and concerns are after pregnancy. Patients that have lots of loose skin or stretch marks may benefit most from either a mini abdominoplasty or a full abdominoplasty to try to tighten and reshape the contour of the abdomen. If patients have really good skin quality and maybe just a little bit of fat that's just stubborn, doesn't seem to want to go away with diet and exercise, those patients are great candidates for liposuction. Also, other body parts involved in the pregnancy, specifically the labia. Labiaplasty is a great operation to try to help to reduce some of the skin and the soft tissue of the labia, which can become enlarged, can become hypertrophic after pregnancy. Other options for the mommy makeover can improve arm lifts, they can improve leg lifts, they can be liposuction for the arms, for the legs, even under the neck. We can do filler and Botox in coordination with the preoperative evaluation, during the operation itself, and basically whatever the areas of concern are that a patient has can be addressed in the perioperative procedure, so either before or after an operation, or with an operation in the operating room itself. So the mommy makeover can essentially be tailored to each and every individual patient and her specific needs. If it's an issue with the breasts, if it's an issue with the abdomen, if it's an issue with how the legs look, how the arms look. Basically, all of these procedures and all of these different areas can be incorporated into what the ultimate mommy makeover procedure is. There is no one size fits all. We want to make sure that it's tailored specifically to each patient and her concerns to make sure she's thrilled with the results and to make sure that we're getting the best possible combination and best effect based on a patient's goals and desires. So on the day of a surgery, the patient will come in, she'll meet with me, she'll meet with the operating room team, she'll meet with the anesthesia staff. And again, what we're doing is going over the areas of concern and reviewing what the goals for the operation are going to be. So I take preoperative photos for all of my patients so that we have that on record. And I then do markings for the operation. And this is a great chance to review what it is that we're doing. Make sure the patient sees the operating marks, like planning where the incisions are going to be, where the liposuction is performed, and just has a general idea of involvement and incorporation and engagement with the surgery itself. After that, we go back to the operating room, and depending on the number and type of procedures we do, it's anywhere from 1 to several hours, again, depending on the surgery and what the patient's goals are. Patient wakes up from surgery in our recovery suite, and usually within a few minutes we have patients up and walking. We have them fitted for a compression garment, and any discomfort that they might have just being a little bit woozy and waking up from anesthesia we can address at that time. So patients can expect to see and feel a difference in their bodies immediately upon waking up in the recovery room. And depending on the surgery that you have done, you'll have different exercises and range of motion activities to help promote and speed up the recovery process. Another way that we speed up this recovery process is by participating in an ERIS, or Enhanced Recovery After Surgery program, basically designed to make patients feel comfortable, faster, and reduce the dependency for medications such as narcotics in the recovery time. So thanks so much for watching this video, just giving you a little bit of information about mommy makeovers today. Definitely subscribe to our channel, give us a like, follow us on social media at Advanced Cosmetic Surgery and at Dr. Peter Felice on Instagram. And check out our website and make sure to get in touch with us with any questions or comments you have. Looking forward to seeing you soon.